Margaret, and I want to thank Sinn Féin for bringing this motion. I also want to thank the Social Democrats. First of all, Minister, I welcome the fact that you set up this, we have a report. I welcome that you did that. I welcome that it was published in relatively quick time. And I welcome the work that went into it. And that's the report of the Strategic Workforce Advisory Group, and there's 16 recommendations. I welcome that. However, the Social Democrats have tabled an amendment simply looking for a time frame for the implementation of that. And you haven't addressed that. Maybe I missed it when I was listening in my office. But that's the most basic, isn't it, after all of the reports? Because actually in this report, they talk about the international problem of recruiting care workers and the multiplicity of reports. So here we have a report. It's a pretty good report. I don't agree with 100% of the recommendations, but I'll come back to that, but I probably won't have time, but in another forum maybe. So that's disappointing. So it would help for trust if you could tell us what is the time frame for the implementation. Now, ye inherited this problem, without a doubt. This model came from the progressive Democrats, the PDs, the PDs, and I had the privilege, or the torture of sitting on the forum, the health forum, for 10 years of my life. I watched the dismantling of the public health service. I watched what Breed Smith has referred to as the commercialisation and the corporatisation of our health service. Now, that was led by the PDs. I just don't even hesitate and say that was their raison d'etre, to privatise everything. And that's what we have now as a result. And we know that. So nursing homes, I think it's 80-20. And this report sets out the percentage. Now, in relation to direct and indirect care, and of course the higher percentages is for the indirect care, and you've confirmed you're paying €27 an hour to companies to enable them to make a profit, when that money should be going to direct. Now, that started with the PDs. Now it's time to change that. It's way past time to change that. That's part of the problem, was the model. And then if we look at 96%, they tell us, are women, and 43% are over 60. I can tell you that if 97% or 96% were men, this problem would not exist. It simply would not exist. We have tolerated a system where women have been treated very badly. I'm going to run out of time very quickly, but the figures here are really incredible. I want to finish in just a few seconds. Clifton District Hospital is an example. We will always need beds. We will always need respite beds. We will always need step-down facilities. And that it could be contemplated that facility would be closed is simply intolerable. Now, I know things have progressed a tiny bit, but we were given many different contradictions. Our hands are tied by the union, lack of staff, lack of demand, and all of the time there are beds in the hospital being occupied. I'll finish on time. Thanks, Chair.